Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. This is huge. This is such a big deal. Okay, look, it's a small deal, but it's a big deal at the same time, and you'll get where I'm going with it. I never thought that the VA was going to switch gears for any of you that have been going to the VA on the VHA side, right? So your Veterans Health Administration, you're going to your appointments and so forth, and you would put in your travel claim, get reimbursed, right, all that good stuff. So remember, prior to COVID, there was a couple things. One, I remember getting cash handed to me. I would go back to the little counter. They had a cashier. You would let them know. You give them your information. Bam, they'd give you cash. That went away. And then the kiosk. Remember the little kiosks? You would, scan your card, you type in your information. I showed up to my appointment, and you would basically put in your claim right there at the little kiosk. Then during COVID, the VA freaked out. Everybody knows, and being the fact that it's federal, one, and two, that it was a medical facility was like a double whammy. It's they had a lot of things in place, and they got rid of the kiosks because they didn't want veterans over there licking the kiosks. Whatever. So they got rid of the kiosks. Never, ever, ever did I think they were going to come back. And that's what this is going to be about. Before I jump into it, I want to throw on a special thank you to Carlos Dixon 2969. Thank you so much for that super comment. I really do appreciate that so much. Thank you again, Carlos Dixon 2969. I appreciate your support. All right, so the headline here is VA brings back travel claims kiosks after pushback from veterans and caregivers. Look, if we shake enough trees, right, eventually something's going to fall. Hopefully it's not a coconut on the head, but the bottom line is that if we sit on our hands, we can be sure we already know what the result will be. But if we put up a little bit of pushback, you never know, right? I think the kiosks are a great thing. Self-service kiosks, were great. The whole travel claim thing had been such an issue after that. Everybody had problems with it, especially at the beginning. A lot of people pushed through that, figured it out, but it was still cumbersome and not quite as easy as it used to be. So with that, hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. We're going to jump into this and see what we can uncover with regard to this, time frames, when it should go into effect. Hopefully they can dive into that. I found this on military.com, and it just came out, I believe it was, October 4th. So sharing it with you here today. And let's jump into it. If you want to support the channel in other ways, you can do that by becoming a member. You go to the homepage, you'll see highlighted members there. They'll kind of scroll through on a random basis, and you'll see a join button. So thank you so much to all you members. I do truly appreciate your support. All right. So this is how it starts off. A popular kiosk-based system for veterans to file reimbursement claims for travel is returning. Like it already, is returning to Veterans Health Administration facilities. The VA has paused plans to decommission the kiosks, which let veterans file for reimbursement of travel expenses to VA appointments, with the kiosks set up at most VA hospitals and clinics. The VA began removing them in November of 2020 as it rolled out an online and application-based program, the Beneficiary Travel Self-Service System, or BTSSS. Nearly immediately after the BTSSS introduction, however, veterans had trouble with it, including the online interface and app. VA staff also had difficulties with the system, developing workarounds or using the old system to approve claims. According to the VA Office of Inspector General, and I will tell you this, I can't even count the number of veterans who just said, screw it, I'm just not even going to deal with it, especially at the beginning when it was so messed up and it was so hard to figure out and the system would time out and it wouldn't let you get to the next page. Many vets that I know, and I'm talking probably around 100, we're like, forget it. I'm just not even going to do it, and I'm just going to complain about it because it's very, very frustrating. And how much money did they lose out on because of that would be a great question. So let's jump into This is just because I read the Office of Inspector General. I don't know if that's what they figured out, but I'm sure. I would love to know the number of vets that just gave up. All right, so according to the VA Office of Inspector General, veterans use the BTSSS for just 49% of all claims through mid-2022. The OIG also found that while the BTSSS was meant to solve claims without human intervention, at least 90% of the time, just 17% were automatically decided from February 2021 through July of 2022. In response to a query from military.com, VA officials said Thursday that the kiosk will remain in place, including those reintroduced as a new pilot program after they were removed. Money well spent, VA. Let's remove them. Let's replace them. I don't know. I think that the right move would have been never replace them, leave them in place, roll out the BTSSS system as an alternative, and let veterans choose which one they utilize. If the kiosk needed a revamped software to drive it to the BTSSS system, then work on that and implement that in there, but still the veteran could push the big buttons that say what they're doing, and they can prove that they're there at their appointment on any given day. It was so easy. All right, moving on. Veterans also will have the option to submit a paper reimbursement form to their local VA medical center or by mail, according to VA Press Secretary Terrence Hayes. We have solicited for and heard feedback from many veterans who prefer the kiosks, and we are exploring ways that we can meet the specific needs of those veterans or of veterans. Hayes said in a statement, VA is committed to delivering timely, high-quality services to veterans and VA beneficiaries in ways that meet their needs and are accessible to them. This includes VA travel reimbursement to eligible veterans and caregivers to and from VA authorized appointments, which also includes CMP exams for those that don't know. Now, I'm going to throw this out there. I guess it's kind of in this kind of, I don't know. I mean, it's in the same vein. The VA really, really, really needs to focus on customer service, right? Customer service and creating a very high level of experience for veterans, the customers, because if you don't want us going to community care, you need to provide stellar service at your locations. Otherwise, why would we want to go there, right? You want it to be as easy and as welcoming as possible for us, and the kiosks are a great addition to that overall customer satisfaction feeling, right? Going in, boom, you're there, you're waiting for your appointment, you're doing the kiosk thing, it's all easy. Moving on. At the start of COVID-19, the pandemic, the VA suspended what was a 30-day deadline for filing travel reimbursement claims, and later, as it transitioned to the BTSSS, began removing the kiosks from the Veteran Health Administration facilities. It's not clear how many kiosks remain available to veterans and their families. The VA reinstated the 30-day limit in May of 2023, but many veterans did not get the news. With that change and the switch to a largely digital process, many veterans and their caregivers struggled to submit travel claims. During a conference of military and veteran caregivers hosted by the Elizabeth Dole Foundation on September 24th, Representative Miller Meeks from Iowa said she appreciated that the VA wanted to make the system better and more efficient, but actually made it much worse for veterans. Sometimes people in their exuberance who try to make things better sometimes make things worse, Miller Meeks said. Why the hell didn't they talk to veterans? Hayes said the latest versions of the travel reimbursement system have been crafted with feedback from veterans, and the VA will continue to update and streamline the process to enhance veterans' experiences when interfacing with the VA healthcare and services. The BTSSS has cost the VA, are you ready? $36 million as of July. The Dole Foundation Function veteran caregivers said they were thrilled that the kiosks which can be used while a veteran is at the facility for a reimbursable appointment, are making a comeback. So happy the kiosks are coming back, wrote an online viewer in an active chat session. I can tell you that there are many, many people that would be ecstatic that the kiosk is coming back. Really makes that whole process very easy. You're there. Proof that you showed up, is that you're there in person. Scan your little card, type in your credentials, whatever it is. So with that, super excited about it. Glad it's happening. If it's not happening in your area, reach out to your VA leadership team there. Reach out to your congressional member. Let them know that you'd love to see the kiosk get put back in place sooner than later. And with that, thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.